Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. Please subscribe my channel and also give your valuable comments. So today onwards, we will going to start another series of lectures, which is related to the approach towards cough in children. Now we know that cough is one of the most common presentation in children, especially in the pediatric clinical practice. Now, when a child with cough come to your clinic, what should be your approach? Okay, so that has to be understood. A proper approach to a cough will lead to a proper diagnosis, and it also leads to the proper treatment. So once the approach itself get misdirected, and then we will land up in a wrong diagnosis and also the wrong treatment, and it will result in treatment failure. So by keeping all these important things in mind, so today onwards we will going to discuss about the approach to a child with cough, and we will see all the details step by step. Now if you say cough, what is the basic understanding of the cough? We know that cough is a very nasty phenomenon, and nobody knows how to control the cough actually. Many used to try, and many preparations are available, medications are available, but actually nobody knows how to control the cough, because cough is considered as one of the protective reflexes of the body. Now, do you want to control the cough or do you want to suppress the cough? It is again, conceptually it is wrong, because you should not suppress the cough, because cough is a protective body reflex. And if you suppress the cough, there is every chance that a foreign material or bacteria, microorganisms, or any nasty materials, they can enter inside the respiratory tract and get into the body. And cough is the one which prevents it. So why you want to control the cough? So actually this is one of the nasty phenomena, and nobody actually knows how to control it. Now for the parents, when they come to you, cough means sputum or some sticky substance which is coming out. But see, parents' version is different, or their thinking is different. When the parents say my child is having cough, for them cough means any sound which is coming out from the respiratory system. It may be a sound which is created because of clearing of the throat. It may be obstruction creating some noise, okay, or it may be some sputum which is coming out, or any other sticky matter which is coming out. The patient always comes to you, and parents always comes to you, and they say that my child is having cough. Now it is left to pediatrician that he has to decide whether what the parents are telling, whether it's really cough or something else. So maybe cough may be a symptom of the airway. So cough may be a presentation because of involvement of the bronchi. Cough may be there also in the involvement of the alveoli, or mucus of the stomach, then loose motion, mucus going. Always clarify before. That's what I mean to say is, see, for them, any secretion which is coming from the airway, that is them means parents, or any sound which is coming from the bronchus or alveoli area, or any mucus secretion which is coming out, and sometimes even when the loose motion, that is diarrhea, is happening with some whitish material, then also they said that cough is going, that is sputum is going through the stool, so he is having cough. So like that parents usually say. Okay, so we need to clarify all those terms now. So therefore clarification of the terms cold, cough and noisy breathing is very important. Okay, so before, parents may tell anything, but as a pediatrician you have to make it very clear that whether the child is having cough, cold or noise breathing, or whether what is they are complaining, whether it is really cough or not. Okay, so if the child is coughing more, suppose if the child is coughing more, it suggests the child is not pneumonic and there is no bacterial disease. This is very important thing. See, if the cough is there, that suggests that disease is pertaining to the airway. Disease is not yet entered into the lung parenchyma, because once the disease entering inside the parenchyma of the lung tissue, then actually cough reduces and breathlessness gradually begins. So if the child is coughing more, that suggests that the disease pathology is still there in the airway itself. It is not yet entered into the lung parenchyma, and child is safe. Child is not pneumonic. Number one. when the child is coughing more, second point is mostly it is a viral. Because in case of bacterial disorders, any bacterial infections, cough will be less. Okay. If it is bacterial, cough will be comparatively less than that of the viral. Okay. In case of bacteria, what happens is bacterial disorders, cough will be less, but illness of the child will be more. Whereas in case of viral disorders, cough will be more and child is almost all active. So this is how we have to differentiate in the beginning part itself. Now, nobody die out of cough. Okay, that is different. The cough is coming as a complication of some of the current chronic pulmonary obstructive disorder and all those things. That's a different issue. Otherwise, simply by means of cough, nobody will going to die. Okay. Now, in Ayurveda, we have to differentiate between Kasa Vega and Kasa Roga. Kasa Vega is a protective body reflex. Okay. Kasa Roga is what is coming in the disorders. Now we know that cough is a protective reflex. So nobody die out of cough. That is sure. Unless and until it is appearing as a complication of some of the death-like conditions. Cough is a protective reflex. So why this is happening? This is happening because of irritation of the airways. Okay. So that irritation may be there in the lumen area. Irritation may be in the wall of the bronchus, or irritation may be from the outside the wall also. So because of all these causes, there will be cough. That means there is irritation of the cough receptors which are present in the respiratory, upper respiratory tract and lower respiratory tract area, and once they get stimulated, then the cough will be there. And if the child coughs more, it is always actually good news. That means if the child is coughing more, it is always a good news. Parents may be worried much. My child is very coughing and it's very distracting and it's very severe. Like that, parents may come out with different presentations. But as a doctor, you should know that if the child is coughing more, it suggests that disease is still in the airway. This is not at entered the lung parenchyma. The child is safe. So for us, it is a good news. So cough suggests an airway disease, and there is no involvement of parenchyma. Okay. So therefore, only there is cough is there. That too severe cough is there, and there is no vigorous medicines required. Don't go for unwanted antibiotics or so many other things. Actually, no medicines required when the child is coughing. Coughing suggests that disease is still there in the airway and child is safe. And give some of the medicines to decrease the discomfort of the cough, and don't give any medicine to suppress the cough. That we will see in the later slides. Okay. Now, patient comes with a cough. Suppose you take a patient comes to you with a cough. Okay. And doctor is asking, how is it? So parents are telling, sir, it is very badly coughing, sir. Okay. Then you ask another question, whether there is a fever. Then he says that, parent says that, no, sir, there is no fever, but cough is very much. Okay. Then you just ask another question, whether there is a past history. Past history means previously also he used to get such type of cough. Then parent says, often he get it, sir. Often he get it, sir. But every time only cough will be there, sir. Actually, there is no fever. Now the diagnosis is over. Okay. There is no need of antibiotics for this case. The cause of the cough in this case is either it is a viral or either it is allergic. That's all. Okay. Either it is a viral cough or either it is an allergic cough. Now, viral cough, if it is viral cough, if it is allergic cough, then how to differentiate? That we will go next slide. Okay, that in the future slides we will go into that. So this is one set. Now, another condition when there is a bacterial alveolar disease like pneumonia. Now, another patient comes to you. He says that patient comes and the presentation of the patient is he has got the fever, and what parents said, sir, my child is having very severe fever. Then you ask, what about the cough? Sir, cough is also there. Cough is also there. Okay. So cough is there means it is an airway disease. Cough is there means it is an airway disease. Okay. So very much. So cough is there means it is always an airway disease. Okay. So very much the cough is more. Now, what about the fever? The fever is also there. So he feels like fever. Okay. Now, in this case, what actually you can see is when there is a bacterial alveolar disease like pneumonia or any other bacterial infection leading to cough is not the major symptom and fever will be the major symptom. You just look at this case. Patient comes to you with the fever, not with the cough. You ask the leading question, cough is there? then he told cough is also there, sir. But compared to fever, cough is less. So that means fever is the major symptom in case of bacterial fever or bacterial cause, and cough is a secondary symptom because bacteria always causes a localized problem. Virus always causes a generalized problem. So it involves the whole mucous membrane. There were so many cough receptors that get affected. But in bacteria, it go and get settled in a localized area, and there may be some cough receptors in that area, may not be. If the cough receptors are there, then there will be mild cough will be there. But the fever and illness of the child looking very ill, okay, child is very sick looking, and that is a major symptom when the cough is because of a bacterial origin. This is how we have to origin. In the first case, we have to continue this. The first case, when only cough is there is no fever, then either it is a viral case or either it is a allergy case. Okay, viral, the first 2 days there may be mild fever, and thereafter fever subsides, and then only cough will be there. Allergic means there is no fever at all, only cough is there. That is allergy. Okay, now in viral, there will be dissemination of the disease. As we know, in case of virus, always there will be dissemination of the disease. It's just like a flood. The virus comes and whatever coming on its way, go on infecting it. Okay, so whole bronchial trees get involved. So what happens? Because of this, multiple symptoms will be there. So you start from the nasal area. When virus going inside, first it infect the nasal area, then postnatal nasal drips, then the oral cavity is affected, pharynx is affected, oral cavity is affected, then larynx. So like this, everything, whatever coming on the way, it get affected by the virus because virus is a disseminating disease. Okay, so therefore what happens? Multiple symptoms will be there. In the beginning, child will have nasal blockage, then the nasal obstruction, then there will be nasal secretion, then come to the oral cavity, there will be postnatal dripping, then comes the cough, then the pharyngitis, okay, throat pain. So like this, everything starts. This is a typical nature of a viral disease. But bacteria is not like that. Bacteria is only localized, and cough will be absent, or if at all cough is there, that is very mild. You just look at the tonsillitis. Tonsillitis most of the time is bacterial. In the tonsillitis, there is no nasal symptom, there is no oral symptoms, only throat pain will be there, and even cough will be not be there. So this is a bacterial tonsillitis. So that will have a minimum symptoms. A bacteria will always have the minimum symptoms. Okay. Now bronchitis. We usually use the term bronchitis. Okay. So bronchitis means inflammation of the whole bronchus. It means whole bronchus is get affected. So this may not be a bacterial because bacteria always causes a localized disease. Virus always causes generalized disease. If I say bronchitis, it suggests that whole bronchus is get affected. So bronchitis is either a viral or maybe allergic. We have got allergic bronchitis. We have got viral bronchitis. We don't have bacterial bronchitis because bacteria cannot cause a generalized disease. Bacteria always cause a localized disease. Okay. Then those who comes with a repeated attacks of the cough and fever. Now suppose a child comes to you. There will be repeated attacks of the cough and also repeated attacks of the fever. Yes, now by this time you know that what it could be. Repeated attacks of the cough and repeated attacks of the fever. Either it is a viral or it is allergic. Either it is viral or allergic. Viral and allergic infections will repeat, but bacterial infection rarely repeats. This is also very important. So why I say, see, here in this case, the child is coming with the repeated attacks of the cough and the fever. And why it is not bacterial? Because another important factor of bacterial infections never repeats. They can repeat. There may be different types of bacterial attacks in case of immunodeficiency. Otherwise, bacterial infections never repeat, but viral infections and allergic manifestations, they repeat. Therefore, whenever a child comes to you with the repeated respiratory tract infections, every month child is getting viral, every month child is getting fever and cough. So this very rarely bacterial, unless and until child is having immunocompromised states. Okay, if the child is having immunocompromised status, yes, there may be even repeated bacterial attacks. If the child is healthy, growth chart is good, height is good, weight is good, everything is fine, still child is getting repeated attacks, definitely either it is viral or it is allergic. Okay, so this is another important thing, how it helps to understand. Now come to the next important part, that's the larger airways and smaller airways. Okay, now whenever there is severe cough, it always suggests that the larger airways are get affected. It suggests that larger airways are get affected. When the smaller airways are affected, the child is having cough, which is mild or moderate cough. Now, this is very important thing. Suppose patient comes to you, child comes to you, very severe cough. She is not stopping at all, continuously coughing. Definitely, this is a cough of the upper airway or larger airway. Okay, so if the child is having smaller airway infection, then there will be either mild or moderate cough. Why? Because as you go down in the respiratory tract, number of cough receptors decreases. Cough receptors are more present in the upper part of the respiratory tract. Simple, basic understanding which helps to identify the disease. Okay, identify the cause. So severe cough means continuously coughing means there is continuous stimulation of the respiratory cough receptors. More cough receptors are present in the upper part of the respiratory tract. As we go down into the alveolar portion, the cough receptors are less. Therefore, in the pneumonia, we don't have much cough, less cough. That the reason is there is no cough receptors. Then how it comes? Okay, so how it is stimulated? No chance at all. So cough indicates the respiratory involvement. If it is severe cough, it is an airway disease. If it is a mild cough, it may be a symptom of lung parenchyma, pleura, or interstitial area. Okay. Now, upper airways. Usually, upper airways will have the dry cough, isn't it? Most of the time, when the cough is because of the upper airways, it's a dry cough. That means most of the time, dry coughs are always because of upper airways. Now we understood another important point. Upper airways means either from the pharynx or larynx, or maybe from the tracheobronchial junction. So you will get either stridor or a hacking cough in such conditions. Okay. So as you go down the bronchial tree, the secretions, mucous secretions will be more. Cough receptors are reduced. Number of cough receptors will go into reduce, but mucous secretion will be there as you go down. So wet cough, when it is cough, so mostly there is involvement of the lower airways, but dry cough is most of the time it is because of the upper airways. In the lower airway, wet cough with or without expectoration will be there. Sometimes wet cough will be there with the expectoration. Sometimes wet cough will be there without expectoration. So this always suggests that the disease is in the lower airway. In the upper airway, mostly there will be dry cough. Now many things are clear, isn't it? Now, so this is the picture that we have to understand. The total respiratory tract is divided. Very crude picture this is, just for understanding purpose. See, a respiratory tract is divided basically into upper respiratory tract and lower respiratory tract. See, in the upper respiratory tract, we have got oral cavity, then we have got pharynx, we have got tonsils and larynx, etc. Okay, then we have got the lower airways. The lower airway or lower respiratory tract. So that is again divided into two parts. One is extrathoracic part, another one is intrathoracic part. Extrathoracic part includes this part before entering into the thoracic area. Okay, tracheal part. For intrathoracic is inside the thoracic area. Okay, so this is the basic thing. Now, intrathoracic part is again divided into two parts. One is a intrathoracic part with the bigger airways and intrathoracic part with the smaller airways. So this is a basic anatomical division. We have totally divided into upper respiratory tract and lower respiratory tract. Upper respiratory tract includes this mouth, oral cavity, etc., tonsils, larynx, etc. Lower respiratory tract is again divided into extrathoracic and intrathoracic. Extrathoracic mostly involves some portion of the larynx and also the major portions of the trachea and also some portion of the tracheobronchial junction. And intrathoracic is again divided into two parts. One is intrathoracic bigger airways and intrathoracic smaller airways. Now let us see. When there is involvement of the upper respiratory tract like oral cavity, pharynx, tonsils, etc., the severity of the cough is more. So cough is very severe and there may be stridor. Okay, most of the time we will have the stridor, and the stridor is monophasic. Stridor is only during the inspiration, not during the expiration. Okay, monophasic stridor will be there. Okay, so you can find the stridor. During expiration there is no stridor, but during inspiration there is a stridor. Monophasic stridor. Okay, that's clear. Now come to the lower respiratory tract. In that you just see the extrathoracic part. In the extrathoracic part, there is involvement like trachea, tracheobronchial junction, and also some portion of the larynx. Then again, the cough is severe. Here also the cough is severe, and stridor will be there because it is also upper respiratory tract only, isn't it? It's larger airways. So, but the strider is biphasic. Strider. See, in upper part, it is strider only only one sided. Okay, monophasic. But in case of this extrathoracic part, the strider is that means inspiration and expression both are get affected. In the inspiration also there is strider, and in the expiration also there is a strider. Typically seen in case of expiratory strider or expiratory wheeze, typical of bronchial asthma also. Anyway, so now come to this intrathoracic part of the lower respiratory tract. There in the upper or bigger airways, in the first few part there is bigger airways, isn't it? In the uppermost part. So there we have got the wheeze. When these airways are get affected, we have got the wheeze. Okay, when the smaller airways beyond this, so that is get affected, then we will have the rhonchi. Okay, rhonchi, or we may have breathlessness. So this is a very clear-cut idea of the anatomy and its presentation of the cough. Now the same thing we can explain here also, microanatomy. What so far I have explained, I am explaining the slides now. The lower airway starts from the trachea and just before alveoli. Okay, throughout the now the lower airway. First we see the lower airway. Actually, it starts from the tracheal portion, that is the lower respiratory tract, and it ends before the alveoli. Now the specialty of the lower airway is the size of the airway in this lower airway is not uniform. As we go down, the size of the airway go on tapering. So it is divided again into larger airway and a smaller airway that we have discussed. So lower is further divided into intrathoracic and extrathoracic, and intrathoracic is again divided into upper and lower. Okay, so this part we have already seen. Now intrathoracic is again divided into bigger airway and smaller airway. This is a repetition. Bigger airway, most commonly we have got the wheeze, which is very common presentation, is in case of asthma. Okay, asthma is basically a disease of the lower respiratory tract, bigger airways. Okay, bronchiolitis is actually the disease of the smaller airways, lower respiratory tract, smaller airways, intrathoracic part, lower respiratory tract, intrathoracic part, smaller airways, and example is bronchiolitis. Okay, so when there is a smaller airways are get affected, then we will have the subcostal retractions, breathlessness, and the cough, because cough will be last. Cough is very less, as it is a disease of the lung parenchyma. Now the lower airways, the lower airways means it comes to the lung parenchyma, so breathlessness is more and subcostal retraction will be there. So cough is less, but breathlessness is more than the cough. So smaller airways, as we go down, almost there is no cough and only breathlessness will be there. Now, what are the points that should be considered in diagnosis? What are the different points that you have to consider in the diagnosis? It's almost all the same repetition. Now, if there is a recurrent cough, decide whether it is upper or lower, then decide whether it's a viral, bacterial, or allergic. If it is upper, we know that there will be severe cough, there will be stridor, there will be suprasternal retractions. If it is upper, but if it is bacterial, then always we find some of the background cause like adenoids, tonsils, or deviation nasal septum, cystic fibrosis, etc. It is upper and recurrent and bacterial, then you have to see the growth chart. So it would have been definitely affected. If it is upper and viral infection, then again just observe the growth chart. If the growth chart is normal, don't worry, it will be get corrected. Okay, so this is how we have to consider the things. Now, if it is accompanying with the fever, suppose if it is accompanying with the fever, then what we have to do? Suppose a cough is there, there is a fever. So presence of the fever always indicates an infection. That infection may be either bacterial or either viral. Acute onset of the high fever. Suppose a patient comes with a cough and also fever, and fever is of acute onset. So acute onset of the fever can be seen in case of bacterial fever and viral infections. Viral fever. Fever which is acute and fever is normal in between the interfebrile period. That is, child is normal in between the interfebrile period, and rhythm is maintained. And fever also gives response to the paracetamol or any antipyretic. then it is mostly it's a viral fever. Okay, in case of viral fever, fever comes down by 4 days. Okay, fever, but in case of bacterial fever, the exactly opposite will happen. Fever may be acute in case of bacterial also, but the interfebrile period is normal and not normal. Even in the interfebrile period also, child is looking dull. Rhythm is of course maintained, and there is no much response for the paracetamol. And very important, as the number of days passes, first day more fever, second day still more fever, third day still more fever. So that means fever going on worsening as the day passes. Exactly opposite to that happens in case of viral. Fever comes down as the day passes. Okay. So suppose if there is no fever, it suggests that no infection, but cough is there, so that may be allergy. That suggests allergic cough. Then you have to take the family history of the patient. So mild fever with a low grade fever always needs confirmation. Therefore, what is important in the approach of the cough is that if the child is having less fever and if the child is having less cough, then you have to be always careful. If the child is having more fever, it may be bacterial or it may be viral. It may be if the child is having more cough, definitely it is either viral or either it is allergic. Okay, all these are safe things, nothing will happen. But if there is only mild fever, in case of tuberculosis, we have a mild fever. If there is only mild fever and mild cough means the disease there in the lung parenchyma. So that has to be confirmed by further investigation. So this is what I want to say about approach to the cough. Now, the next part of the approach to cough that we will deal in the next class. Thank you very much for your listening. Please don't forget to subscribe my channel and also please give your valuable comments. The next part of this approach to cough that we will continue in the next class. Thank you very much.